This is an horseshoe or U-shaped retinal tear. It is a full thickness neurosensory retinal break secondary to vitreoretinal traction. Etiology of this condition can be PVD, high myopia, penetrating and blunt injury, family history of retinal detachment and lattice degeneration. Symptoms of this condition: sudden floaters or flashes, dimness in vision, reduced peripheral vision. And signs of this condition: you can look for a PVD and U-shaped retinal tear, usually at superiotemporal and superionasal quadrants. V's ring, and you can look for a vitreous hemorrhage and hemorrhage around the retinal tear. Diagnosis: with a 360-degree fundus examination, you can find this tear. Treatment of this condition: if the patient is asymptomatic, we have to advise for a close observation. If they are symptomatic, we have to start with a cryotherapy and photocoagulation and vitrectomy in cases of vitreous hemorrhage. For daily updates, subscribe for iCare. Tata, bye bye everyone. Click, clack,